You are now listening to the Serious Growth Podcast with your host, Leo Costa Jr.
You know, I've known you actually for quite a few years. I mean, I don't know exactly when you started over at the studio. What year was that?
I started in my clinic 2013.
Okay, is that when you came over to my place for a while? Was it 2013?
No. I used to be in Hanford.
Oh, that's right.
So I started Hanford 2004, and I think Atisa found you 2008.
Yeah, she came in first, as a matter of fact. I remember that.
We've known each other for 12 years at least.
Oh, my goodness. I almost know you as long as my first wife.
Yeah, you and I went, you brought me on KC24 for the first time.
That's exactly right. And actually, I took a trip down to LA with Atisa one time. Yeah, you remember that? Yeah. And then I went to a couple parties. And so we've kind of got a little bit of history now, huh?
Yeah, absolutely.
You're my doctor. Speaking of doctor, how old were you when you knew you wanted to be a doctor?
17.
17.
Yeah.
And what made you decide at 17 what influenced you?
Well, my mom was a dentist, and I was trying to figure out I was a senior in high school, and I wanted to know, what I wanted to do. And I took a class in biology. It's like an honors class in biology that was like an encapsulation of all of med school in 1 year. And so it had anatomy, biochemistry, study of diseases and stuff.
Yeah.
And I just fell in love with it. And I thought, I'm going to be a doctor. So I went to undergrad. I did a couple of years of research at Harvard. Kind of left the medical field for about 7 years, and then decided that I really wanted to do this. I went back and got my master's in physiology and started med school in Chicago.
What I think is amazing is that at the age of 17 that you would know what you wanted to do. I mean, at 17 years of age, I'm thinking about what I was thinking about. It wasn't even close to that.
Yeah.
Anyway, listen, welcome to Serious Growth Podcast. My goal and the mission of this podcast is to tell the truth, or at least a version of the truth, even if it goes against popular belief. I really don't care about that kind of stuff. What I'm concerned about is telling the truth and telling why. The why is always really important to me. So I appreciate you coming on today.
Sure, absolutely.
And again, so when you we know a little bit about when you got in. So were you an MD at that point then? I mean, what was your first, when you were now an official doctor, was it MD?
Yeah, I'm an MD.
Oh, you're an MD. Okay.
Yeah, I'm not a DO.
Okay, and then MD, is there like, again, I'm asking a lot of questions that might be dumb, but when you are MD, is there a certain like a path or a certain area that you go in, or is it just MD?
So we do 2 years of, we do 4 years of schooling in medical school. The first 2 years are just in the classroom and a little bit of clinical stuff. And then the next 2 years is all in the hospital. So we rotate surgery, OBGYN, internal medicine, all this stuff. And then and emergency medicine, and so all the general fields of medicine, and it's also gives us a way to see what is it that we like to do.
Oh, that's a good idea then. Gives you kind of a snapshot of that.
Right. And so then at the end of the fourth year, you get your MD degree and you apply for residency. So in terms of what field you wanted to go into.
Got it.
I thought I went into med school thinking I was going to be a psychiatrist because I thought I wanted to sit down and talk to patients. And then I realized that psychiatrists actually don't talk to patients. They just write them meds.
Really?
And I thought, well, that's kind of a waste. I'm doing 4 years of med school. And I really liked pediatrics and I liked internal medicine. So then I decided I'm going to do family. So I decided really late into med school. I mean, 4 years I thought I was going to be a psychiatrist, and then at the end I thought, I really like all these other fields.
Yeah.
And so I wound up doing that, and then I went into family practice. I started George Washington, did my last 2 years in Northwestern, and got to be a co-author in a book in family medicine, and wound up in California. I didn't want to stay in Chicago. It was too cold.
Yeah. Sounds like it's too dangerous too.
Yeah.
Watching the news. Yeah, it's interesting. And so you mean that these TV shows I've been watching where the psychiatrists, where the people come in, they sit on the couch and they talk, that's not true?
No, that's like completely fiction.
Wow.
So, because the issue is that, they only get paid, doctors are getting paid, $70, maximum $90 a visit. And your overhead is about $65 a patient. So, so they're making like $30. So they can't sit there and talk to a patient for an hour because, they're losing money. And so, unfortunately, doctors should be getting paid. I take my cat to a vet that's medium priced. I'm out $99 before the vet even touched the cat.
True.
So we're all being underpaid. And that's why we're having a lot of problems of people going to, sorry.
It's all right.
Going to, like not going to into primary care. Yeah. It's not because we have a shortage of doctors. We have plenty of cardiologists, and it's because they're making like $600-700 a patient, with all this testing that they do.
Yeah.
But for family physicians and internal medicine, we got to see volume, which we don't like to, I don't enjoy seeing 50 patients in a day, I enjoy seeing 30 patients in a day, but not 50.
Well, that would be, to see that many people, it would wear on you. I would think that, you're not going to be as fresh. I don't know. To me, it's like I'd rather see less people and be able to put more energy into that than all of a sudden be, like you're saying, seeing 50 people, and all of a sudden it becomes like this, sort of mailing it in. The chances of doing that would be greater, I think, if you had to do that every single day at something.
Yeah. It's part of the good thing of becoming a physician is that you get a chance to have an encounter with a patient, and you're they're kind of entering, bringing you into their life,
Yeah,
and that whole
relationships, right?
Exchange is, I think, really, that's why I became a doctor. I think part of the reason it took me so long to find my way back to medicine was that, I seen a lot of these doctors, they're like, oh, it's so hard, and, they're not paying us as much, and they're, always complaining. I was like, oh my God, why would I want to do this field, even though I like the whole subject? And it wasn't until later I realized that, your profession is what you make it.
Yeah.
It's not what other people have done. And so I really like this contact that I have. And so I've kind of made my profession my own. Yeah. And I remember the first day I started working in Hanford, I thought, oh my God, if I knew this is what it would be like, I would have kept going after college and just, because I felt like that's exactly what I wanted to do. But, hindsight, when you're in that situation, when you don't know, it's really hard to know if this is the right profession for you. But I know that I absolutely would not be happy doing anything else.
All right, let's take a quick break so I can tell you about our product.
Do you want a bone-crushing grip? Good, because you're gonna get one with the amazing new TRS gripper. It's a progressive grip builder with longer handles and a special ergonomic design that's like a dozen hand grippers in one. Start off easy and work your way up to quickly build your grip strength from wet noodle to pulverizing. The package includes a video from the world-famous strength coach, Dr. Russ Horine, the man who worked with Leo Costa to help bring you big beyond belief in the Bulgarian Power Burst. Dr. Horine shows you a simple and easy to follow workout plan that takes just minutes a day right from in front of your TV set if you want. So click on the link below and let's get started building you a stronger, firmer, bone-crushing grip.
I think that's really important. One of the things that's guided me because I was born and raised on a dairy, and in my culture, it's, the next generation takes over the old farm, you know what I'm saying? And I ended up there, and I was so miserable because it wasn't something that was in my blood. Passion, that's what you're talking about.
Right.
And ever since I got into my field, that, I've never gone to work really a day in my life, and yet I've gone to work every single day. You know what I'm talking about, because it's a different perspective.
Yeah.
So let me ask you this, and what I'm fascinated about what you said was the reason that you got into being the physician is that the interaction with people. So do you think doctors, I've heard this more times than not, I think sometimes, is that about doctors having bad bedside manners, but yet it sounds like you got into it, that based on what you're telling me, you probably have good bedside manners, because I know you. And I would say that you do, but I find it a little bit ironic. And is that something that's kind of a stigma in your profession, or a misnomer?
So in primary care, you cannot survive as a primary care physician if you don't have good bedside manners. So good bedside manner is more common in primary care than it is in specialty. And so part of the thing with the specialty is, if you have no social skills, you become a radiologist.
Oh, gotcha.
Because you don't have to deal with anybody.
Kind of like a mortician?
Right. Or you become an anesthesiologist. They're all like knocked out.
Oh yeah, great.
So those are the two professions. There's a running joke saying that, people that, all neurologists have headache usually because they have some, and then, psychiatrists is their own. They have their own issues too.
Listen, the good thing is that there's a place for everybody, right, in the medical field, right? That's funny that you said that. Yeah,
the issue is also surgery. Surgeons are probably the most arrogant people I've met. There's some that are really good.
Is that the God factor? Are you talking about like the God factor at that point, those guys?
Yeah, like what? I'm sorry?
Like those, I'm assuming that when you say that they're the most arrogant, is it because they get that like God complex?
Oh yeah. I didn't hear you. Sorry. Yeah, it's the God complex that, some of them, they feel that. So, and that actually works against them, because if they made a mistake, like if I make a mistake, I'll tell the patient, that was a mistake. I try not to make them, but if I do, if somebody, for example, if I say something to someone, I'm willing to say I made a mistake. I shouldn't have said that, or I shouldn't have done that.
Yeah.
So humility, is not something that's common with surgeons, because they feel that if they admit that they're wrong, that might mean that when they cut, there's a possibility that they could be wrong.
Right.
And surgery is so decisive that you can't undo a cut.
Right.
You can't undo a snip, And so in their head, they have it in their head that they're the best. And if the surgery didn't go well, it's not their fault.
Yeah.
And that's a problem.
Well, yeah, it is, but yet I can see to some degree how they might think that way because of what you're saying. It's so black and white. And it's almost, when I was playing football, I had one of my mentors said, look, anytime you get hit, I was a quarterback, so I'm a target. He says, whenever anybody hits you, don't ever let them see that you're hurt. Don't ever. That kind of reminds me of that. It's like, but no, I know what you're saying. Okay, so, all right. So when you go out for your first, now you've gone through your residency, and it's time for you to take that step. You're out on your own. I don't know about you. I would say that in my field, there's not as much at risk, I don't believe, unless you're, hurting people. And I was, it was pretty frightening to go out there, and all of a sudden I'm out there in the real world dealing with real customers. Was that your first time out now, from residency, and you're on your own without a net? Was it pretty frightening, or do you remember that?
Yeah, so let me take you into my mind.
Okay, good.
Okay. So as a medical student, I was older than most of the other kids. And so I had at least my social skills. And when you're a medical student, you can't make a lot of mistakes unless you're like really stupid, because you have your intern then you have a senior resident, then you have like 3 doctors watching you. And so hard to make a mistake. And so you have those guardrails. When you residency, you have one less guardrail. You still have some guardrails.
Okay.
But I remember my first rotation in my residency was doing a rotation in internal medicine in a hospital that didn't have, so a lot of hospitals, their ICU is separate from the step down unit where, they're not hooked up to all kinds of things.
Yeah. And
they're less acute. And then there's another unit where they're about to like send them out. Okay. So there are 3 stages of care. And usually in most hospitals, they'll have one set of physicians or residents taking care of the ICU, and then another set that takes care of the inpatient, and another set that takes care of the ones that are not very critical or they're just about to go home. Now, in everyday practice, that never happens. If you have a patient in the ICU, you see them in the ICU. Then when they go down, you see them in the step down unit and all that stuff. And the hospital I was in, they didn't have these separate things. If you were a resident and you had that patient, if the patient was in the ICU, you would follow them to the next until they got out, or if they were in the regular unit and they got really bad and they went into ICU, you had to go there.
Yeah. So
my first day I was on call, and you're like just thrown in there.
Yeah, no kidding.
And even though you had 4 years of school, it's not enough to know what to do.
Yeah.
So I remember my resident told me, and we had to be like on call. Like my first day, I'm there at like 10 o'clock in the morning or 8 o'clock in the morning. And then they tell us, oh, by the way, you're not sleeping tonight because you're going to be sleeping in the hospital. I'm like, okay. And so my resident took me to this ICU room, and she goes, you see those monitors? It monitors the patient's heart and your blood pressure. I want you to look at that monitor. Don't take your eyes off the monitor until I come back, and I'm going to go to sleep right now.
Oh, man.
And I'm like, okay.
No pressure.
And I'm thinking, what if something goes wrong?
Yeah.
Like what do I do? And
yeah.
But the great thing was I really always appreciated the nurses, because I think that nurses in the ICU are really good at what they do, and they helped me a lot.
Yeah. And
so I was never too arrogant to ask for help from nurses, from other staff, or somebody that I thought, hey, he's been doing it or she's been doing it for a while. She probably knows what I should be doing.
Yeah.
And so that always helped me, but I was terrified. And the issue was that I was thinking, why do we have to be up for like 24 hours? Why can't they just have 8 hours and then you go home, and the people that are going to take on, they come back, and that makes more sense because you're all alert and all that stuff. And I still remember this to this very day, what my attending told me. This was a critical care attending. She's the one that took care of like the critical care unit.
Yeah.
And she said, I want you to be able to step into an ICU room half asleep and know exactly what to do.
Yeah.
And I was like, I'm thinking, you're crazy. I mean, when does that happen? I mean, you don't have all your faculties.
Right.
But what happened is over time, you're on call, you get a call, and there's certain things that you have to go through your head. Okay, you got to check this. It's almost like when you fly a plane, you know how you have to check all the gears before you can go off. And if you do that enough, it becomes so automatic. And I think it was my 3rd month I was on that ward. I was doing 3 months. And by that 3rd month, and I was on call, they'd wake me up, and we would have to, like, each one of us, when we were on call for like 20 patients. So the entire hospital was under the care of one overnight group of residents. It was two interns, one junior resident, and one senior resident, 4 people. And we took care of the entire hospital because all the other doctors and all the residents would go home. So they would they would give us these sheets of these patients. And I remember one night, one morning, I got up to make my rounds because I was on call, and I went up and made my rounds, or I think it was like 7 o'clock or 6:30. And one of the nurses waved at me, and she goes, "Thanks for that order last night." And I was like, "What order are you talking about?" She goes, "Yeah, I called you about this patient." And I was like, "Let me see the chart." So, I'm like, "What did I do?"
You can do it in your sleep.
And so what happened was that there was this one patient, I guess, that had fallen or had some dizziness or something, and I had asked what the patient was on, because the nurse told me what I asked her. I said, "What did you ask me? What did I tell you?" Because I didn't want to. I was like, "Oh my God, what if I made a mistake?"
Right.
And she said, "You asked me what the patient was on, what his symptoms were, and all that stuff." She goes, "Then you ordered an EKG, you ordered some labs to make sure his heart was okay, and you explained it to me. And then you told me that if the EKG is normal, don't call me. If the labs are abnormal, call me." And I said I didn't need to call you, and the patient needed, I think, some Tylenol or something, or some other medication, which I looked and it was appropriate.
Yeah.
And that light clicked in my head that, oh my God, that's exactly what this lady meant. Because later, what I wound up later doing in my last year of residency in Chicago, they allowed us to moonlight. So in addition to being on call every fourth day, you had the opportunity or the privilege of moonlighting aside from that, because, they don't pay us much as residents. And I was married, I had a child.
Yeah.
And so I took all the moonlighting I could. And in the moonlighting, I mean, you're half asleep, and they call you with an admission, and you have to find out what is it that needs to be done. And how do you see that patient first from the 3 patients that you got admitted, or you see them at the end?
Right.
And it just became so kind of routine.
Yeah.
And when I came to Hanford, I used to cover 2 ERs, and it was like I would be like half asleep, but I would have checked all the things that I needed to check.
Yeah.
And then I also had something saying that if they get worse, call me. If they're not getting better, call me. And that's how I was able to go through, and I could go right back to sleep. And that I could only do that for 8 or 9 years. Once I hit my late 40s, early 50s, I was like,
motivation
okay, I
changes.
can't do this anymore, because I can't fall back to sleep now.
Right. No, that reminds me very much of, like, in my sport, in training. I learned this when I was working with the Olympic teams, and they believe the Bulgarians, repetition is the mother of skill. And that's exactly what you were doing, where, certain teams would go out there and they'd be over the bar getting ready to lift, and they'd be yelling and screaming. But the Bulgarians did this 1 rep maxes 50 to 65 times every single day, whether they felt good or not. It's kind of similar, it sounds like, where it was just muscle memory. They just walk up to the bar, lift it, and they could do that no matter what, and no matter what circumstance. That's what it sounds like. And you sound like a highly trained military guy. I have a buddy of mine who's been in combat, and he says they train so much for that. He says he actually feels more comfortable in that environment because he's trained for that. It's all, that's where he's comfortable.
Well, the issue is then you have to develop your own style. I learned more in the last 6 months of actually doing moonlighting. And when you moonlight, you're the doctor, and you have the attending who's at home. So you moonlighting for him, and he never gets a call because I'm the one that's doing all the work.
Right.
But the issue is that I learned more during that time than my entire residency.
Yeah.
Because, well, I'm sure I learned in my residency, but in order to learn how to be able to be on my own.
Yeah.
And I learned like how to listen to my own sense. You got all the information. Okay, you have everything you need. But then the question is, okay, what are you going to do?
Yeah.
You can't look up in a book.
Right.
You got to go from what you think should be done.
Yeah. And it's hard to do because you have to trust. You have to trust your own instinct, and that's a tough one. That's a tough one to do.
And I think that's the art of medicine, is to learn how to listen to yourself, how to listen to your instinct.
Right.
And one thing that has always helped me is to never feel that, I can fix this.
Yeah.
I can do that. It's
Yeah.
not about me. It's about what can I do to best help this patient. And my sense is I'm going to do whatever I possibly can to help them.
Yeah.
Not that, oh, I'm such a great doctor. Patients come in and tell me how they appreciate my care, but I don't, the minute you become, you boast about that, is the minute that you start making mistakes.
Yeah.
Because, you know what I mean? Because for me, I always think, okay, maybe I'm missing something. I never think, okay, I've got everything. I've missed nothing. I never think that.
Yeah. It's important. Something, Daria, it's to stay disciplined like that. Not many people can really do that. If you take a look, and again, maybe I'm speaking, maybe more from my industry, but it's like the minute you start taking things for granted is when you get caught,
Exactly.
And but yet at the same time, it's very hard to stay disciplined to that, because like in my area, it's like in fitness, it's like, okay, the motivation has to be greater than the obstacle. But what trumps the motivation and the obstacle is the discipline, because at some point the motivation is not going to be there, or you're going to be tired and you're going to start making mistakes. When you have that discipline underneath your belt, I think that's very important. This sounds like what you're talking about. Yeah.
So like for me, there are times that I'm like, I got to go home, dinner's on the table. I have this last patient just walked in, and I'm thinking I'm going to miss dinner, or miss the beginning of dinner, or some event I have to go to. And I have to really fight that urge to like think about that. So what I try to do whenever I get that sense, like, I'm thinking about something else, I shut everything else out. And I think I'm here in this room with this patient to figure out how I can help them.
Right.
They've waited an hour in my waiting room, and it's hard because when you're seeing lots of patients, it's easy to think it's probably nothing. Like that can go in your head, and you could be 80% of the time right.
Yeah.
But the reason they're seeing me is not because I'm an 80% doctor. It's because I look at that 20% and make sure I don't miss that.
Yeah.
So for me, I always check myself that, when I feel like I'm kind of agitated, or like that, there are patients waiting and I'm getting kind of stressed out because I don't want them waiting a lot. And then if there's a patient that needs more help and more time, and, when I get to that sense, I kind of check myself and say, okay, it's going to take as long as it's going to take. And that's what happens when I go in a room and I'm doing surgery on a patient. If it's taken too long and I've got like 10 patients waiting in the waiting room and 4 patients in the room, and it should have taken 15 minutes, but it's just taking longer.
Right.
I'm like, you know what? This is the patient that I'm treating.
Right.
So when it's done, that's when I'm going to come out. And patients appreciate, initially some patients don't, but they're not the kind of patients I would want.
That's a good point.
If a patient feels that time is more important than quality, there are plenty of doctors they can see, and plenty of PAs they can see that don't have nearly the knowledge or the patience to be able to take care of them. But to each their own.
That's exactly right. And the great ones are hard to find. As when you play at that level, I use a lot of metaphors from professional athletes, and one that I use is a professional tennis player, Nadal, and he's from where is he from? Spain. And he talked in the interview one time. He said, what I try to do when I'm out on a tennis court is I try to win every single point. That is so much harder to do than to say it. And that's kind of what you're talking about. You're going all the way. You're going to finish that baby no matter what.
Yeah.
And that's what he was basically saying. I want to win, and I make it a point, because what that does in sport, when he faces his opponent, they already know that they're going to have to play all the way to the end, because he's not going to let them off the hook. I just find that really interesting, how that mindset, in a way, is kind of like what you're talking about. You have to have a strong work ethic and mindset and discipline to do that. It's not easy.
Yeah, the issue is that for me, what I do is I have a checklist in my head. Did I check this? Did I check this? Did I check this? As I'm talking to the patient, and I try to leave the room when I feel my work is done.
Yeah.
When I feel like, okay, I've covered all the bases. And if I leave the room and I feel that I haven't covered all the bases, it kind of eats at me.
Yeah.
And I feel like I haven't done a good job. And if I feel that, then it just, work is no longer enjoyable. Because for me, work is enjoyable when I feel like I've taken care of the patient. They feel satisfied with my care. I feel satisfied with my level of care in terms of figuring out what's wrong with them or trying to get them better or sending them to the right specialist if I can't figure something out, and covered all the bases. When I've done that, then I feel like I'm okay leaving the room.
Yeah.
Sometimes that takes 5 minutes. Sometimes that takes 15 minutes.
Right.
But, I don't think patients care that much about how much time you spend with them, but they care about how much quality time you spend with them.
Yeah.
So if you're actually listening to them and you're totally engaged, then, because for me, work, I go to work in the morning and all of a sudden it's like 1 o'clock and I'm like, what happened?
Yeah.
And then I come back, afternoon is a little harder just because I'm a little older now.
Yeah.
And I get sleepy after I eat. But afternoon, if I'm busy, by the time it ends, I'm like, oh, it ended. So work to me doesn't feel like I'm like, oh my God, I got to go to work again today.
Yeah, I understand that. So
it's like,
it's
not work.
Right. And that's kind of the way I am. Ever since I got into my line of work, it's passion based. And again, it poses all the obstacle that normal work does, but I'm seeing it from a different perspective. So in your line of work now, what have you gotten into now that you're really excited about?
So I do now, I've gotten into a little bit of holistic health. So I do IV vitamin therapy. We do IV chelation. So these are ways of treating chronic problems, fatigue, things that medicine has not been able to help them much. So it really helps them boost up their immune system. I'm also doing stem cell therapy. We do stem cell therapy for hair. I treated myself.
Oh, okay.
I do IV stem cell therapy. We do stem cells and platelets injections into joints to regenerate some of the cartilage and the tissue. That's very exciting for me. I'm just starting IV therapy for weight loss with carnitine.
Interesting.
It's like a mix, and patients, and then I'm going to be starting some regenerative infusions with NAD, which has shown that it kind of rejuvenates the mitochondria and cells that act more like a younger mitochondria with a higher level of metabolism.
Sounds like the fountain of youth.
Yeah, so it's so those are the things I'm excited about. Everyday medicine is fine. It's a little boring sometimes because you're like, okay, all the tools at my disposal, I've used them, and the patient still has, pain. They still have fatigue. Their thyroid is okay. All their labs are okay. I've sent them to a rheumatologist. They've seen a neurologist, and none of them have been able to help them. And then when I start them on the IV treatment, they start getting better.
Let me ask you this: with holistic medicine in your field, is there friction among the people that would be more, I'm going to call them more purist, more, when you're doing the IV therapy, are they going, yeah, come on?
Yeah. Part of it is jealousy, I think.
Yeah.
And I think part of it, doctors are they're very competitive with each other. And so, if they're not doing it, it's probably not a good thing.
Right.
I'm a scientist, at heart, because that's how, I did research. I got my master's. So clinical and scientific medicine, evidence is really important to me. And all the things that I've done, I've been based on clinical evidence that's there. Now, someone can say, well, it's not strong evidence, but, like, for example, IV vitamin C therapy, it was, for a long time, it was kind of out on the fringes, but now mainstream hospitals are using it, because it boosts your immune system, boosts energy. And so they're using it at I think the Mayo Clinic in their ICUs. They're using IV vitamin C therapy for patients who are septic because, studies have shown that it helps. Now, sometimes it takes a while for studies to catch up with how patients are feeling when they're getting these treatments.
Yeah.
But most of the stuff that I do are pretty much backed up by some sort of research that I would feel comfortable giving it to the patients. And usually I get the treatment too. So I think I don't have any treatment that I have not given myself.
Yeah, I think that's important. And I have firsthand experience with the IV therapy because 8 years ago I had these strokes. And I tell you, I was amazed. I mean, you talk about immediate. I mean, with me, I could feel it with the first injection that I did. There was no question about it. And I'm the bodybuilder who's been taking supplements for 30 years. So I know when something is working or when it's not,
Yeah.
And that was just so amazing to me. I was taking glutathione and alpha lipoic acid and vitamin C. That was the cocktail that I was given at that point. And I'll tell you what, man, I really believe to a certain degree, maybe a larger degree, it was part of the reason why I made such a strong comeback, because I got on the front of that when it happened. And I guess it bypasses the liver, right? It goes right to the cell.
Right. I mean, the part of the problem when you take oral is that only a certain amount gets into your blood.
Right.
And then it depends on how your GI system is working.
Yeah.
And then it also can irritate the GI system. So you can't actually take that high of a dose of vitamin C orally because it causes diarrhea.
Yeah, that's true.
It causes abdominal pain. It irritates the intestines. But you can take it IV. I mean, you can take 50 grams IV. It won't cause
it bypasses that. Yeah. Aren't they using the vitamin C for the COVID?
Yeah. So, it's an off-label. But you mean you're talking about in the hospitals? Or?
Yeah, I'm just hearing that vitamin C helps with, I don't know if it's preventing COVID or speeding the process up. I'm not sure. I just heard that.
Vitamin C boosts your immune system.
Yeah.
So when you have an infection, your immune system is stressed, and it usually depletes your body's vitamin C levels. And so whenever you give vitamin C, it replenishes what the body has lost. And so it allows the white blood cells to work better. Zinc is also, another treatment that I'm giving patients, and Dr. Zielinski from New York, his protocol calls for when people do have corona is zinc. So, a high dose of zinc, like 220 milligrams. Well, I also give a cocktail of vitamin C with zinc, as well as the vitamin Bs. Like B1 also helps the immune system. So I give that. We give vitamin C. I give zinc with it. I give some vitamin Bs just to boost up the your energy level.
Yeah.
But I gave that to a COVID patient before we found out that she had COVID, but she had symptoms, and she recovered in about 3-4 days.
Is that right?
I mean, I gave her medicine too, but this is a patient who had stage 4 cancer. I figured, she's not going to do well.
Right.
But I gave her some hydroxychloroquine and some zinc. And then before that, I gave her an infusion of vitamin C, nice hefty dose of it. And she pulled through. She got symptoms for a couple of days, but she didn't go to the ICU. She didn't go to the hospital. So vitamin C infusions mixed with zinc and some vitamin B, folic acid, all that stuff, helps to boost the immune system. My staff takes it during the flu season. and pretty much none of them get the flu for a couple of months. So every few months I'd have the entire staff get IVs.
So how many times a week, or how often do you do the IV?
For patients who have cancer, stage 4 cancer, they'll come in once or twice a week to get the infusion. For patients who want to boost their immune system, they could do it once a month or once every 2 weeks to do that. I think once a month that's a maintenance dose. If they want to do it more, they could do it once a week. I probably wouldn't recommend more than once a week for, vitamin C if we're not doing it for a particular thing. If we're just going to boost your immune system, I think, once a week, once every 2 weeks is sufficient.
Is there like a half-life?
For vitamin C?
Yeah.
Yeah. I don't know exactly I think the vitamin C, you mean the effect of vitamin C probably lasts in your system for a couple of weeks.
Oh, okay.
Yeah.
Yeah. But yet for maintenance, you're thinking that once a month?
Yeah, once a month I think is good.
I mean, I guess if you have a pretty strong immune system to begin with, you just need a little help.
Yeah. I think I would definitely do the zinc though. If someone has they're around people with COVID, I would probably do it every 2 weeks.
Uh-huh.
But if not, once a month is actually a good maintenance for vitamin C.
I've been hearing a lot about zinc. Now, is zinc very absorbable for those people that can't get IV? For example, is taking zinc in a pill form, does it absorb or?
Yeah, I mean, you can so there's a couple of options. If you don't have corona and you want to take something oral, I would suggest to take vitamin D, D3, and about 5,000 to 10,000 units a day. I would also say it would be good to take zinc. You could get it in something called Zicam, which is about 10 milligrams. I would take it 3 times a day. And I would do vitamin C orally. I would take either emergency, it's a powder.
Yeah, I take that.
Maybe twice a day, or even once a day is fine. Every time you take oral vitamin C, only about 100 milligrams gets absorbed, regardless of how much you take.
Yeah.
If you take the soluble kind,
you'll see your urine turn like a beautiful fluorescent yellow or whatever.
Yeah, if your urine turns yellow, it means that you probably had a lot of vitamin C in your system, and the body only took what it needed.
Yeah.
I've taken vitamin C when I've been really sick, and my urine doesn't turn yellow because my vitamin C is so depleted.
Yeah, it's taken
that all of it is taken up.
I'll be darned.
So that's how you know.
Yeah. Let's take a quick pause to tell you about something you are definitely going to want.
Do you want a bone-crushing grip? Good, because you're gonna get one with the amazing new TRS gripper. It's a progressive grip builder with longer handles and a special ergonomic design that's like a dozen hand grippers in one. Start off easy and work your way up to quickly build your grip strength from wet noodle to pulverizing. The package includes a video from the world-famous strength coach, Dr. Russ Horine, the man who worked with Leo Costa to help bring you big beyond belief in the Bulgarian Power Burst. Dr. Horine shows you a simple and easy to follow workout plan that takes just minutes a day right from in front of your TV set if you want. So click on the link below and let's get started building you a stronger, firmer, bone-crushing grip.
I've caught the flu twice this year, and I have not missed a day of work.
Yeah.
Because right after the day that I feel like, oh my God, I'm really sick.
Yeah.
I do an IV.
Yeah.
And I make sure, I'm wearing a mask and all that stuff. And
oh, it's amazing. I mean, like I said, I can attest to all that. I mean, it's a real deal. Okay. Now you talked about stem cell therapy. Why don't you, in layman terms, bring me up to speed on how that really works and how that all got started?
Sure. So stem cells, it started with, bone marrow stem cells, or I'm talking about autologous stem cells that come from your own body. Mm-hmm. So stem cells are also in umbilical cords. the stem cells that we're talking about are stem cells that can turn into any cell in the body. And those stem cells are called mesenchymal stem cells. And they're found around the vasculature of blood vessels, around the fat. So our fatty tissue is very vascularized. So there's cells that are right around the capillaries. It's called stromal vascular cells. And a big portion of them are these mesenchymal stem cells. And these turn into any cell.
Really?
Yeah, so what happens is that if you have an area of injury, your body produces these chemicals that attract either platelets, or it attracts resident stem cells in the tissue. And all tissues have some stem cells there to generate. But a lot of times the amount of injury may overwhelm the amount of resident stem cells that are there. And so what we do is when I inject it into the tissue or in the IV, it homes to those areas because of those chemotactic factors attract the stem cells, because it tells it where the body needs the stem cells. So some of those chemicals go into the bloodstream, and it signals stem cells that are in the nearby tissue to come to that area. And so when we give stem cells, when I give it IV, it homes to areas that need regeneration. That's the.
So what about, I've heard like where you spin, is that different stem cells?
Yeah. So when we get the stem cells, when I do the stem cells, I take the fat cells, I do like a little liposuction.
Yeah.
And we separate the stem cells from the fat cells, and then we spin it down, and we separate the cells from the tissue.
Yeah.
And that's how we treat that.
Yeah.
And then we also take the patient's blood, and then we spin the blood and we separate the platelets. And the reason we do the platelets is that if I'm injecting into a joint, I want those stem cells to be activated. Mm-hmm. And the platelets have growth factors that activate stem cells. So what we do is I take the stem cells. When we're taking it out, obviously there's a little bit of bleeding, and there are some platelets that are already activating the stem cells. Mm-hmm. But what I do is I take extra platelets from the blood, and then when we inject the joint, we'll inject stem cells, and then we'll also inject platelets. And the platelets, as soon as they hit the tissue, they open up, release all the factors, stimulate the stem cells, and they start to regenerate the tissue. That's
fascinating.
Injured. Yeah. So we've actually been able to inject it into shoulders, and if a patient has a partial tear of the rotator cuff, it's healed the rotator cuff. Now, if the tear is big, it's not going to do anything. But if it's close enough, it'll regenerate the tissue.
I'll be darned. Now, I'm going to assume that there's no rejection. In other words, when you're pulling stem cells or out of a certain part of the body and putting it into another area of the body, does the body always accept it because it's its own?
It's your own. Yeah.
It's your own body, right? Yeah.
So there's some places that get like placenta stem cells, they call it. They call everything stem cells now because everybody wants them.
Yeah.
And the problem with that is that it's not your own cells, so the body gets rid of it. So the only benefit is the chemicals that they're secreting. But they charge like, close to what we charge to do stem cell therapy. And the difference with them is that they'll be able to do 6 patients in an hour, and I'll do 1 patient in 6 hours. That's the difference.
Yeah.
And they get this thing frozen, they thaw it, and they inject it into the tissue, and they're done. Go to the next person. And some of the other problems that there are chiropractors that are doing that. I mean, they're not physicians, but everybody's sitting on the bandwagon. I started doing it not necessarily as a money maker. I started doing it because there are patients of mine that didn't want surgery, and they want to know what else they could do to regenerate their cartilage. And so one of my friends down in LA is an orthopedic surgeon. He was telling me of how good platelets worked, and so I started doing that. And then another friend of mine was doing stem cells and told me that stem cells work even better, and that's when I started to do that for patients. I already had like 6 patients lined up because they wanted to go down to LA to get it done. And I was able to do it for like 30% cheaper than what they charged.
Yeah. With that being said, is it like cosmetic surgery? Do they have to come out of pocket to pay for this, or does?
Yeah, it's all out of pocket because it's off label and it's not FDA approved.
Yeah.
So, but there's a lot of, I was trained by one of the pioneers of stem cell therapy, Dr. Alexander. He's in Montana, and he's a plastic surgeon who started doing stem cell therapy on patients, one for plastics, and then he started doing them for joints and started doing IV. So he trained me before I started doing this thing.
Okay.
Robert Alexander is his name.
Okay.
Yeah.
So let me ask you this. And go ahead, Daria.
No, nothing.
Oh, okay. Sometimes there's a delay. As you're moving forward now how long you been doing your medical practice now?
My clinic or been in practice?
Just been in practice. How long? How many years?
I've been in practice in California since 2003.
Okay, and then you've been in your clinic since 2013?
7 years. 2013, I started my own office. I used to run a 12-doctor group for about 7-8 years.
Okay, so as you're moving forward, do you think that the foundation or your core group of business will always be as a medical doctor with these other things that you're doing with stem cells? It's more of an add-on. Is that the way you see your business?
Yeah. I think that, I don't want to lose my identity as a physician, and I enjoy, helping patients, figuring out what's wrong with them, going beyond what other doctors, offer them. I don't want to be a doctor that offers all the things and, does basically evidence-based medicine is just basically a middle-of-the-road doctor.
Yeah.
I think I want to be something more, and I always strive to figure out what else I can do to help my patients that may not be kind of beyond what modern medicine offers. Modern medicine doesn't offer health. It offers, how do you get, so if this is health and you're here, you're sick, they bring you right here. I want to bring them here.
Right.
So from here to here, modern medicine doesn't really offer much.
Yeah.
And so that's what I'm trying to do.
Yeah. So you have to be willing to, again, that takes energy, takes discipline to do that,
Yeah. I started with thyroid medicine. So I have a lot of patients who have like a suboptimal thyroid. So their thyroid is not quite. So if the normal value is from here to here, if your thyroid is normally here, right?
Yeah.
But then you start feeling tired and your thyroid comes up to here, it's still above the normal, but you're having symptoms. So what I wind up doing is I give patients like a little bit of thyroid medicine and to see if that improves their symptoms. They're kind of subclinical hypothyroid.
Yeah.
But there isn't really any literature for that, but patients do better. I keep their thyroid still within that range, but they feel better. Sometimes people do better on a little higher level of thyroid hormone.
Right.
And so that's how I started. I'm like, I could make them feel a little bit better, still within the range. I started doing hormone replacement therapy for men, for patients whose testosterone level is actually really low and they have symptoms. And then we increase it, and then I monitor them, make sure that it doesn't affect their liver, it doesn't affect their blood pressure, it doesn't affect how thick their blood is.
Right.
If it's controlled, I think it's really helped a lot of my patients. It's helped a lot of my female patients too, who lost their libido.
Yeah.
So
I'm one of the people that can attest to that kind of stuff, 65 years of age. And, as a personal testimony, I can tell you it's a difference between feeling like you're following versus feeling like you're leading, because that stuff really does make a difference, and I do know in my background, bodybuilding, there's all kinds of abuse, and I did the whole stuff back in those days. I understand how that works, but something, there really is a healthy way to do that, is what I guess I'm trying to say.
No, absolutely.
And it makes a world of difference for those people that are out there listening to this. It's amazing what a little bit will do for you, especially as you're getting a little bit up there in age. It's unbelievable, really.
Yeah. I wish they would make it legal for doctors to prescribe growth hormone.
Yeah.
Or prescribe if it's controlled, obviously, not just give them a prescription and let them, or what was it? There's also another shot for weight loss. I think it's called, I'm blanking out. It's a shot. It's what women produce when they're pregnant.
HCG?
Yeah, HCG.
Yeah.
So HCG, I mean, from what I know, when people take HCG, they actually lose weight. It's a great, and it doesn't really have any big side effects. And
no, it doesn't.
If these things are monitored by a physician, I think it's completely safe.
Yeah.
But there's FDA doesn't mind approving medicines for rheumatoid arthritis that increases your risk of cancer, but they have problems, approving like growth hormone or HCG. I mean, especially HCG.
Yeah.
It doesn't really have a lot of side effects, or even sometimes chelation is off-label for patients with rheumatoid arthritis. Yeah. It's not, it's not FDA approved, but it's a lot healthier than getting Remicade in your vein.
Exactly.
I had one patient who for rheumatoid arthritis, they got something called Remicade. It's to help them, but it suppresses their immune system. She had brain cancer the next year.
Oh my goodness.
I'm like,
yeah. How good was
and
that?
the FDA is okay with that because so the FDA gets paid by the drug companies to approve their meds. So they are adamantly against anything that might be considered holistic. If they can put their finger on it, they're like, no, we're not going to approve that. And I'm like, you guys it should be an independent institution, meaning that the drug companies should not be able to pay the FDA to conduct research or for, to have some of the money get funneled into the FDA. They can pay money into the government, and the government can allocate money, but it should be a completely separate
too much
from a drug company. And they're not doing that. They're like in constant communication. And this whole thing about stem cells, some people come out and say, oh, it increases the risk of cancer and it increases the risk of like tumors. And that's not true, because mesenchymal stem cells that come from your own body have very low telomerase activity. Telomerase is an enzyme that's high in cells that produce tumors or produce benign tumors, like, umbilical, like, what do you call it? Like fetal stem cells. Those are the ones that are, and so they say that stuff because what they're trying to do is scare the public. Oh, these are like, I have hundreds, I've treated probably over 100 patients, and 99% of them can swear by the stem cells. I mean, some patients, they don't get better for their knees if they have so much, loss of cartilage. If they've lost, their meniscus, it doesn't really get better. And I tell them that, so it's not like, oh, this is going to cure you. I tell them, this can help. This has helped my patients. These are their studies. You can read them. You can make a decision, but know that it's not FDA approved.
Yeah.
But so that to me is a lot better deal for a health insurance than paying for, getting stem cells even once a year is cheaper than getting Remicade, which costs $3,000 per infusion every month or every 2 months.
Yeah.
Right? That's like 6 times 3 is what, 18 grand.
Yeah.
And that's year. And then if they get cancer, well,
even more.
Get brain surgery, that's like a couple of $100,000. So they're okay paying that stuff, right? But the FDA is like, I think that there's just a big problem with how they demonize people that are, or practices that are not mainstream. Mainstream offers you cancer. Mainstream offers you side effects. Mainstream, like they just found that the drugs that are used to decrease your acid production in your stomach now has been associated with chronic kidney disease. Mm-hmm. I'm like, oh my God, how many patients have gotten that?
Exactly.
And the FDA has approved that, right? So I'm like, who's at fault here?
Yeah. Well, like you said, oftentimes it's about health, but it ends up being more about money and power and all that good stuff.
Exactly.
It's pretty sad. You don't, as a consumer, you don't want to think that stuff actually goes on, but it does.
Yeah.
And that's just the bottom line of that thing. So it's people like yourself are the ones that, people need to know about. And with that being said, as we're wrapping this show up, is there anything that you would like to, because it's been really fascinating. I mean, we've been going now for a little over an hour, and it just seems like we just got started. Very good information. Is there anything that you would like to let our viewers know where they can find you, and you can promote it here on the show?
Sure. Well, thank you. I'm in, my office is Maj Medical Clinic, M-A-J Medical Clinic, and you can find us on the web at medicalclinicvisalia.com. My phone number is 559-740-7989, and we're located at 5109 West Goshen Avenue here in 93291. I'm also on Facebook. What I offer and what my office offers is a holistic approach to medicine. So I do regular primary care, but if you need something more, I offer that too. So if you want, to do IV therapy, you want to do holistic care, you don't want to be on meds, you want to try something natural, I do that too. So I can take care of like the needs of a patient that wants to be healthier. They just don't feel good.
Yeah.
So I have patients that I treat that have chronic Lyme disease. I have patients that I treat that have valley fever, rheumatoid arthritis, all these things. They see their specialists too. I don't, I'll send patients to a specialist too if I think that they need, but I also treat them to make them healthier than where they're at now. I'm trying to make patients as healthy as they can possibly be.
Nice. Your message and your goal is the same as mine. When I got into the industry, in the fitness industry, it was to get people in the best shape of their lives, and it's never changed. And I like the way you think. And with that being said, Daria, I really appreciate you taking out your time and coming on the show. And
Thanks.
very, very, very good stuff. Very interesting.
Thanks for having me. And you're great on camera.
Oh, thank you,
You've
sir.
always been that way.
Thank you, sir. You can
All right.
stop saying that for about another 30 minutes. Well, I'll talk to you next time, okay?
All right. Take care.
Okay.
Bye.
Thanks for listening to the Serious Growth Podcast. For more episodes like the one you
All
just
right,
listened
we're off there
to,
now.
subscribe to us on your
Hey,
mobile
that's a
podcast
good,
app.
really good
and
interview.
leave us a review.
I knew it
If
would
you'd
be.
like to reach out,
Yeah, you
can
and I
find
talk-
us
we
online
talk
at
all day.
Oh, yeah.
seriousgrowth.com.
No, I knew it would be.
Until next
By the
time,
way-
train smart and train hard.